So for our listeners, do you want to introduce yourself and let us know what you do?
Sure, of course. So I am Dr. Laura David. I'm actually a GP by background. I don't practice medicine anymore, sadly, but it's actually all for the greater good because I am a founder of a business called Smart About Health. And Smart About Health works with global organisations to support the health and well-being of their workforce. And we do that in lots of different ways. So that could be through policy writing and strategy, also through large global programs for employees, so covering all different aspects of health and well-being. And then working with employee resource groups, which is an incredible opportunity. And then manager training, very important, well-being champion training, leadership programs. So you name it, we are doing it, and we've built up this amazing team of over 200 doctors and psychologists that we work with.
Yeah. I've got loads of questions.
Yeah, right.
I want to ask about the medical background.
Yes,
so how,
sure.
what was the transition between being a doctor to working in workplace wellbeing?
Do you know what? It's quite difficult. When you're a doctor, you're kind of like sold this identity. You know, you are a doctor. You know, people don't even call you your real name. They just go, doctor, can you do this? Can you help me? So, you know, you go through medical school, that's 6 years. Then, you know, I went through a bit of a career change in healthcare anyway. I was trained to become a surgeon, which I always wanted to be a surgeon. And then I sort of was quite devastated that I actually didn't want to become a surgeon. So I switched into general practice. So that's my background in general practice. When I was in general practice, I actually had my second daughter, so who she's now nearly 7, and I experienced my own challenges with my health. So I had postnatal depression, and that was also quite difficult for me because that's the kind of thing that, you know, you get told when you're a doctor. Well, that doesn't really happen to you. That happens to, you know, your patients only. So that was part of the transition. That's what actually inspired me to move forwards into building Smart About Health. But it was quite a sort of big transition. I kind of cut down the days being a GP, built up the business, and now I'm totally convinced and totally sold that I can do much more good for people in this work that I do now.
Yeah. So it's moving, I guess, into a much more preventative space, right?
Yes.
'Cause if I've understood it correctly, the medical model behind this tends to be a bit more about the individual and what they can do and around disease prevention, that sort of thing. But you want to go upstream by working in the workplace.
We're going upstream because actually there is a crisis in healthcare. People can't get appointments. The type of treatments that are available are, you know, they're very well placed. It's important that we have these services in place to treat things like cancer and heart disease. And, you know, as a GP, you are doing some preventative work. Of course, you're working to try and screen people for different conditions and intervene early, but it doesn't always work like that. You know, so there is still some prevention in general practice in healthcare. When you work in hospital medicine, of course, it really isn't. It's treating sick people all the time. So if we only rely on that part of sort of care in the environment, we can't. We actually literally can't. We've got to start by embedding the structure and the strategies in our communities, and the workplace is that incredible community because we spend, you know, 70% of our working adult lives in the workplace. Some professions probably more than that. So what I see is the opportunity to make work good for you, make work good for your health. We hear all this, you know, one of the biggest problems is workplace-based stress. But we need to tackle that. There's many ways we can tackle that, but we also need to ensure that work is, you know, adding these quality years to our lives, that it doesn't just cause detrimental harm.
Yeah, absolutely.
So you mentioned before about the sort of team and army of healthcare professionals that now sort of work with you to reach the workplace audience. How do they find and engage with the idea of kind of taking it out of perhaps a healthcare setting and bringing it into the workplace? Has it taken some convincing, or are they ready for the challenge?
Do you know what? It doesn't really take much convincing because the people that work with us, the doctors, the psychologists, they are really behind that we are making a difference in a different way. And it's the same, like, I guess, sort of passion that I have, which is, you know, I can work with somebody one-to-one when I'm a GP. Yes, you know what, I've got so many stories of incredible sort of connections with people and how we've made a difference to people. They have those same stories, but they know you can reach hundreds, thousands of people all at once. And what you're doing is trying to equip people with the sort of life skills and sort of perspectives. You know, and I'm simplifying it because obviously some things are very complicated and serious, but, you know, to actually prevent people needing help from a psychiatrist. And everyone that works with us is really brought into that. And in fact, some of the cardiologists, so the heart doctors that we work with, they also often do a specialty called lifestyle medicine. And lifestyle medicine is quite a new branch of healthcare. It's all about root cause and prevention. And, it, you know, I truly believe it's the future of how we're going to do health. They want to put themselves out of jobs. You know, they don't want to be stenting somebody's cardiac, you know, artery because it's blocked. They want to prevent the blockage in the first place. And so everybody's very much on board with that sort of prevention. We can make a difference that way.
Yeah.
Amazing.
Yeah.
And how have you, can I, sorry, I've got to jump to another question. So how have you find, especially with the sort of real change in context of this information and knowledge that you've got, the change of context from, you know, working in healthcare setting to being in the workplace, convincing business leaders and HR teams and the employees themselves that those things are important and can make a difference? How's that process been, getting the buy-in?
Yeah, because the people listen to you as much.
Yeah.
You listen to your doctor, right?
Yeah.
Whether or not you do what they tell you, you at least listen to them, whether in the workplace. Do you listen to wellbeing professionals? Sometimes.
Yeah.
You kind of, I'm not
So
sure.
that is, you know, for us, that's also what we believe we can offer the workplace, you know, the opportunity to interact with doctors in a completely different way. It's not just when you're sick and you go here. Actually, you know, the doctors can come in and do the groundwork with you, which starts, you know, it starts with education. It starts with improving people's understanding. So there's definitely a very strong and good reception to the fact that everyone is so well qualified, you know, in our team, and that leads to a lot of buy-in sort of quite naturally in itself. And there might be particular sectors that, you know, specifically love it, you know, but it's relevant to everybody. People definitely cling on to that fact that we're all doctors, and you know, all of our clients, they call me Dr. Laura. Like, you know, I didn't ask them to call me that, but it just sort of happens.
We should have said that at the start.
No,
Sorry,
it's absolutely fine. I'm all good with the name. But, you know, there can be some, you know, challenges getting buy-in anyway, because this concept of well-being is quite hard for organisations to sort of, I guess, define, thinking about what does that actually mean in terms of their people. But what we often do is work with senior leaders, and that's a really great place to start when you want to get buy-in in the organisation. And really, it's actually focusing on like their humanity. You know, they're humans. That despite the fact that they've got to a very senior position, and that's highly commendable, they're actually just as human as all of us. And, you know, if we can bring that humanity from them into the company, that really helps to drive that culture where health and wellbeing is prioritised. But also, it is like their opportunity to focus on themselves as well, because they've got pretty high stress, high pressure jobs. Yes, they've worked some things out, haven't worked it all out. And unfortunately, you know, as we age, we're much more likely to experience health-related problems. So it's really important that they stay healthy, and that there's definitely buy-in with that, for sure.
So what about, a bit of a left turn, but you talk about qualifications. How do you feel about unqualified people doing this in the workplace? So to my background, so I'm a business psychologist, I call myself, and I did a master's in work psychology, but nowhere near as qualified as yourself. But then you see other individuals coming into this space who, you know, they don't have any background in it seemingly whatsoever. And part of my head says, we need to make it accessible.
Yes.
And then part of my head says, is there a risk that it becomes a little bit the Wild West? I don't know.
It's a really good question. I think there's a place for everything. And I think, you know, we can't just leave sort of health and wellbeing in the hands of doctors and highly qualified people, because actually well-being is for absolutely everyone. What I do think is there is a risk of, people who don't have the qualifications or the clinical experience or the day-to-day experience giving advice.
Yeah.
I think that's quite dangerous. And actually we don't give a lot of advice in our work because it's hard to advise 1,000 people at a time. There is a space and there's a place and a time for individual consultations and sort of personalised questions. I think it's that balance between giving people the empowerment to embrace health and well-being. There's a lot of lived experience stories out there, and I think giving a voice to those is powerful and important, and those people are putting themselves out there, right, to be these role models and be the stimulus for someone else to share their story. It's so fantastic. But I also think that there is there's a sort of a space that can occupy. And actually, if you want to occupy a different space, which is about sort of, what are the most robust treatment options? What are the most evidence-based preventative options? Where is healthcare going? What are the problems that we're seeing? That doctors and clinical psychologists, for example, are in a much better place to be more advisory around that.
Yeah. Sorry, I was just going to say I tend to agree. From my perspective, it's about boundaries, isn't it? And I try very hard not to overstep. I do a lot of coaching, for example, and that could quickly turn into a borderline therapy session sometimes. Yeah. But there's been parts where I'm like, look, I'm not a clinical psychologist. If it's going to go down this route, then I think you should talk to X, Y, Z. Like, I'm not the person to have the conversation with.
Yes.
But you do worry sometimes whether somebody would overstep that mark.
And I think one thing on that, though, is that, if you're coming from a very personal place, which, as I said, is really an important space to adopt, but, you might be more biased in your opinions of what works or what doesn't work or what kind of things work. And actually, in this space, you need to be as much as possible unbiased when it comes to, let's just give an example that, depression is a very common mental health condition. If you have it, if I have it, if you have it, we're all going to experience it very differently, and different things and different treatment models or different self-care options and different methods are going to work differently for us. So, in order to be able to sort of give somebody an unbiased answer to, how do we combat depression, we need to be able to give the answer that fits into, multiple different categories. And I think if you're coming from a sort of space of, this was my experience, it's absolutely fine to say, look, this is my experience, this is what worked for me, or this is what didn't work for me, but not influencing others to then say, oh, therapy doesn't really work, or, antidepressants are, it's just a placebo effect. We need to be much more balanced about that kind of advice.
Yeah. Well, one of the reasons for this podcast and for the Working Well community is because we believe that what we've experienced is that there isn't really a blueprint for how organisations should do this. And actually, what's really positive is the many different people that are coming into this space from different perspectives, whether it's a highly trained medical professional or a yoga teacher. There's lots of different contributions. And the tricky bit is, helping organisations navigate what they need and making sure that everyone in the space is working ethically and with boundaries. But you're right, there's so much passion in the space as well, and so much lived experience that it's important that everyone's really aware of that, and we try to sort of spread that message, don't we, through these conversations.
And you want more conversations. That's the other thing. You work with managers, and I do work with managers, and I'm trying to encourage them to talk. I don't want them to think I need to go and be a therapist to the people within my team, but do they need to avoid mental health as a topic entirely? Well, no, absolutely not. My line on it is that you're responsible to have the conversation, but not for fixing all the problems. And actually, the feeling that some managers get that I won't know all the answers to that, or this is going to go out of my span of expertise, then leads to them saying, well, I'm just not going to talk about that at all.
Yes.
And I'm just going to help that person manage their emails. And it's like, well, yeah, but they've got all this going on that you're just kind of the elephant in the room that you're not even mentioning.
Yeah.
And that can't be healthy either. So there's a bit of balance there, I guess.
There is a balance, and I think, it's equipping managers with the confidence to know, it's kind of quite a Western sort of modern day phenomena that we are always having to be the solutionizers. You know, we have to have all the answers. And what that even means is that, like, you know, a manager, I'm just giving an example because it could be anyone, but, you know, is having an interaction with somebody who's struggling, and they're not even listening because they're now anxious about, do I have the answer to this? You know, what am I going to say? How am I going to deal with this? So they actually don't even listen to the person. So it's actually about stripping it back to what are the sort of core skills that the manager needs to be able to navigate. So when they're working with somebody who's experiencing difficulty or a challenge, but also how do they create a culture in their team where problems, you know, are able to surface more easily. They don't bubble away and, you know, chip away at somebody's, you know, ability to even do their work. Actually, can they be surfaced early so they can be intervened with early in a much more simple way? So if you give managers the right sort of training that, you know, equips them with more preventative skills and more proactive skills, then you're saving them a lot of hassle in the long term, which is, you know, we cannot erase the fact that people will have personal difficulties. They will bring them to work. They may be workplace-based difficulties that, you know, in some cases the manager is the problem. And that's also important, you know, for how do they have that conversation? How do they then know where to steer that? Because it might be that conversation needs to be had with somebody else as well. You know, we did a big session yesterday, and I think about 90% of the questions were about, how do I tell my manager this? How do I, my manager is this problem. How do I tell my manager they're causing me this much anxiety? So there's absolutely a role for coaching or training or giving managers the opportunity to be better when it comes to managing the sort of health and well-being of their team, but not saying you're there to go, oh, I think you've got depression, or I think you've got this problem, and, you know,
diagnosing people. They
should not be diagnosing anyone, you know, and also making sort of assumptions or solutions, because, you know, they want to think that they've got the solution, but actually if you can help them to step back from that and say, do you know what, you don't have to have the answer. Just listen to this person. And in a coaching way as well, you know, coach them to see what do they think is the best solution here, or fix here, or, you know, outcome.
Absolutely. You mentioned champions as well. So tell us more about those. So
I love champions.
Yeah.
It's probably one of the proudest, you know, moments that when we initiated our champion program, which is now in its 3rd year. We started it because we were being asked over and over and over again, you know, can we do something that isn't mental health first aid? And there are obviously some things that surfaced about mental health first aid that companies found that they weren't working. So we actually developed a clinical team that were able to put together a champion curriculum and then a full wraparound sort of safeguarding for these champions so that they're operating in a very safe way. We started the program with Ocado, and they are in their 3rd year of. They are the most incredible humans that come into this.
With Artie.
Yeah. So Artie and I sort of worked together to develop their program. And you know, it's been so successful in their business, and the champions are an integral sort of part of the tapestry of their organisation. They're there to. It's part of the solution, which is. Not all of care starts with doctors and professionals. Actually, care in the community is one of the most important things. That's actually a solve. You know, I'm simplifying it incredibly, but that's one of the solves for the problems that we have, which is that all care starts in professional care. Actually, it doesn't. So if we can embed really robust programs that uplift people within workplaces to be supportive, to be, you know, people who can signpost, people who can have those conversations, people who can share those stories, people who can be ambassadors for well-being, you know, promote people having healthy habits and engaging in also difficult conversations is what they do in a very safe and protected way. So we give them a lot of supervision, the champions, all with clinical psychologists.
That's often what they're lacking, right? Is that supervision. We
can't just let them get on with it. This is actually unsafe. So we need to provide from the organisational side and from any external training provider's side. And that's why doctors and psychologists are so well equipped to offer that, because we actually have supervision. We don't operate in a way that's sort of, you're just let loose to do what you want. Actually, you need to be able to recalibrate, check in, process difficult cases, process the emotional part of the role of being a champion, because regardless of whether you say, this is your role and that, you must not come outside of this role, and we do a lot to help them manage their boundaries, but they are dealing with very, very difficult cases a lot of the time, because human beings are complicated and we have complicated lives, and it doesn't just stop at this point. And so we've got to keep them safe. We've got to let them have spaces to process that from internal perspectives, because sometimes it's going to be, I haven't got enough time, or people aren't coming to me, or, I'm overwhelmed, or I'm actually going through something personal at the moment and I feel like I haven't got capacity. There's a whole host of things that sort of need to be considered about these champions. And now Ocado have got hundreds of wellbeing champions across their logistics and their tech function, and they're just the most amazing human beings and so passionate. And where we're up to now with it, because we do this program in many other organisations as well, but people want to become champions because they've received care and interaction from a champion.
Just the experience for them.
Yeah.
So, sorry.
Well, no, I was actually going to add more to do with and ask a question around the actual delivery of their job, like getting it out there. Because I'm a wellbeing champion in an NHS setting.
Fantastic.
And it's really tough to actually have a voice. Get a little slot on the agenda at the end of our kind of weekly meeting, and people know that that's the hat I wear, but it's mostly like, Alethia's banging on about wellbeing again, as opposed to feeling empowered to how does the programme sort of support that bit of it, the communications, I guess, and the execution.
So it has to be very joined up with the business.
Yeah.
So it isn't just like, let's just get an external training provider to come in and do this. It has to be planned with the business, and it's like, they have to have a roadmap and a strategy. How are they going to make sure that their champions are visible and effective and empowered and maintained as well? So there are responsibilities on the business side too, to ensure that this is all brought together, and it's going to look different in different businesses how they do that. But they've got to be known. And one of the first objectives of starting a wellbeing champion training is, does everybody in this business know who the wellbeing champions are, what they do, and what they don't do? So it's really important that people know that, because otherwise they might expect too much, or they might expect too little from them. So getting them out there, some of them, it depends what kind of work you're doing. If you're like in a factory setting, or if you're in a depot, for example, how do you make yourself known? Lots of posters, lots of visibility of the champions, different lanyards, when you're working face to face, giving people those slots where they can be more visible. Maybe it's at the beginning of a shift, having a briefing. So it's not the end of it. It's like at the beginning. It's lots of our champions have, gone off to do their own initiatives, writing wellbeing news mails, creating men's mental health circles. That's been one of the most amazing things. Inviting people to their own initiatives and just building up that momentum. And it doesn't happen overnight, because it's quite a big change for an organisation. I think one of the things that we do in our training with them is, first of all, make the training feel very unique to their business. And so we're considering what kind of roles they have, what kind of organisation it is, how we can make sure that is factored into the training. But we have to start with why. We go all Simon Sinek on them. We do a whole session, on purpose and what is their personal why, because their personal why is going to drive them. It's going to continue to drive them. And what's the most beautiful thing is to share those whys, share that purpose. And some of the champions, or a lot of them actually, come from a place of, they have lived experience of something, maybe it could be mental health struggles, for example. They either don't want someone else to go through that, or they've gone through a period where they feel energized and recovered, and they want to give back to people. They want to be the person that was someone to them. So there's actually quite a lot of maintenance, which comes back to that, how do we wrap around the care of these champions, because they're giving so much of themselves. a lot of them also have other skills that they can bring. It might be around communications. It might be around, being a voice, having power. And so people who are quite senior. So it's non-hierarchical, our program. So, you can be the most senior person in the company or the most junior. It doesn't matter. But if you have a specific position of power, we're going to have to help you leverage that so you can be a voice. So it's helping them to connect with themselves, but also connect to some of the values of the organisation as well, and help them live that as well.
Yeah, that's so much better. So I'm on record about my thoughts around mental health first aid, which I'm not completely against, I promise you. I think that it has a place in terms of, bringing well-being up the agenda and whatnot. But I attended the training, and I'm not sure I found it hugely useful. I spent a long time learning about schizophrenia and whatnot, and I was like, this is, I guess, interesting information. And I guess if someone was having a psychotic episode, then I would feel slightly more confident to be able to help them out and signpost them. But the whole piece around how do you have a preventative conversation about workplace pressure and the whole why, that wasn't there. So I left that training feeling like there was a gap there, and if I felt like that, I felt like other people would as well. And the risk as well is people then would fill that gap with their own why. And if you've not had that conversation, then that's when it leads to the overstepping of the mark that we talked about before.
And I don't think it should cross somebody's mind really that this person might be experiencing schizophrenia or psychosis. That's a really difficult diagnosis.
Yeah, absolutely.
And, they might, I think what is important though is to understand that mental health conditions are actually very common. And when you are encountering others, you may well come across people who are experiencing these problems or conditions. And what we like to do, you obviously can't cover everything anyway, even in more extensive, compressed training, is invite people to be curious in an authentic and non-invasive way. So, you're not going to have heard of every single mental health condition. If somebody chooses to disclose to you that they experience a particular condition, nobody's going to expect you to know exactly what that is, unless you are a doctor or even a psychiatrist, if it's mental health related. But be curious and, say, how does that impact you? How does that affect you? What kind of things are you struggling with? Are you struggling with anything? Because also, I think it's just so important to demystify the fact that a mental health condition means mental illness. Actually, people go through a lot of different fluctuations. There might be periods of mental illness with a condition like schizophrenia. You may go through very long periods of feeling really well. And, we want to celebrate that. We want to also encourage that, people who do live with long-term health conditions, including mental health conditions, to be in work, because we know work is good for you. And it kind of comes back to our, original driver, which is like, how do we make sure work is good for people?
Yeah, we talk about that a bit, don't we? Like work has somehow become a baddie at times. It's killing us and ruining our personal lives, but actually they can come together and
well, it's
work in
funny.
harmony.
One of the keynotes today, Dame Carol Black, right?
Yes.
She was saying this exact message, 15 years ago?
Yeah.
It was like, make work good for you. And I feel like hopefully finally we're making a bit more inroads into that. But yeah.
I think we are, and I think it's really positive.
Yeah, me too.
Final question for you. How do you look after your well-being?
Do you know what? Being a founder, it has been difficult. There's been quite a lot of challenges. But over the last few years, I've kind of worked out a bit more. I've also got 2 young children. So when I started this business, my youngest was 0. So you're kind of also experiencing that, like, as a parent, how do you look after yourself? Well, it's quite tough. So parent and founder, there's quite a lot of work to be done, let's say. Now I have a coach. So I have a coach once a week. And actually, when I'm coaching, I make it like a non-negotiable, even if it's pouring with rain. I'm walking while I'm coaching. So this poor coach of mine, she hardly ever sees my face. But, she's amazing. So, try and get out into nature, try and do a walk, like a long walk, 2 or 3 times a week. And I've got my really nice routes that I do. And then if I'm really busy, I'll just try and do a really short walk, maybe like 15, 20 minutes. And there's amazing data which shows just getting outside for 15 minutes is a really preventative mechanism for stress and burnout, for example. I go to the gym, so I really love weightlifting. I'm a really competitive person, so don't judge me on that. But like when I was a child, I was a competitive athlete. You might not be able to know that from just looking at me, but I kind of take that back into the gym now. So I do a lot of like weightlifting classes, and I use the opportunity to create like social connections as well, because we also know that that is one of the underlying threads. The evidence shows that social connection is like the biggest factor for happiness and longevity. So I've got a really nice community at my gym, and I'm spending. I sleep a lot. I love sleep.
The young children.
Yeah. I always say
How do you do that?
I always say that. I love sleep. I love sleep. It's the best part of my day.
Sometimes I go to bed when they go to bed. My kids are not.
That is the trick. That is the trick.
Honestly, they don't go to bed early, so sometimes I go to bed before them. But I don't. I try not to compromise on my sleep. Like I know that I will feel good if I've had a good night's sleep.
Absolutely.
Amazing. Well, thank you so much for sharing with us today.
Thank you.
Thanks.